This is Module 3, Chapter 5, Safety and Risk Management. Please review this module and complete the assignment with a minimum score of 80%.
When discussing safety and risk management, we need to look at a variety of factors. In this chapter, we'll discuss how to develop an incident action plan. Incident action plans ensure that everyone knows what is going on. We'll describe the initiatives that have been implemented to reduce EMS provider injuries and deaths and list the most common causes of personal injury and deaths to EMS providers. We will describe principles that each agency should practice to prevent emergency incident injuries and what safety considerations should be taken. We'll also look at components of an infectious disease control program. We will describe procedures for conducting and documenting an accident investigation and list the elements of a post-incident analysis or hot wash. There is a separate class that deals specifically with the incident safety officer position. EMS operations often include high-risk situations that can occur under any weather conditions at any time, day or night. The EMS officer is responsible for ensuring that every provider completes every incident without serious injury, disability, or death. In short, it is your responsibility as an officer to ensure that everyone goes home. As an EMS officer, you must identify hazards and dangerous conditions to provide a safe work environment for EMS providers. It is your job to identify and correct unsafe behaviors. Good safety habits should be incorporated into all activities. You must set a good example for others to follow. The EMS officer develops an incident action plan that addresses and minimizes the chance to harm personnel by identifying and controlling the factors that might lead to injury or death. Prevention depends on your ability to avoid the events that might lead to injury or death. Everyone Goes Home is a program developed by the National Fallen Firefighters Foundation, the FFFF, to prevent line-of-duty deaths and injuries. The principles and practices used by the Everyone Goes Home initiative are extremely applicable to EMS agencies. EMS providers must work in teams at emergency incidents, and EMS officers must maintain accountability at all times for the locations and functions of all members working under their supervision. Reliable two-way communications must be maintained throughout the chain of command. It is possible all personnel should have a radio. The radio should be treated as a tool that can be used as a lifeline. EMS Volunteer Event Notification Tool, also known as E.V.E.N.T, is a program of the Center for Leadership, Innovation, and Research in EMS, CLIR, with sponsorship provided by the North Central EMS Institute and the National EMS Management Association, the Paramedic Chiefs of Canada, the National Association of Emergency Medical Technicians, and the National Association of State EMS Officials. E.V.E.N.T is a tool designed to improve the safety, quality, and consistent delivery of EMS emergency medical services. It collects data submitted anonymously by EMS practitioners. The data collected will be used to develop policies, procedures, and training programs to improve the safety delivery of EMS. A similar system used by airline pilots has led to important airline system improvements based upon pilot-reported near-miss situations and errors. Any individual who encounters or recognizes a situation in which EMS safety event occurred or could have occurred is strongly encouraged to submit a report by completing the appropriate event notification tool. The confidentiality and anonymity of this reporting tool is designed to encourage EMS practitioners to readily report EMS safety events without the fear of repercussions. Fire departments may use web-based systems to report their misses at the www.firefighternearmiss.com. Heart attacks are the leading cause of death for public safety personnel. Risk factors that contribute to these deaths are obesity, high cholesterol, smoking, and family history. Fire and EMS personnel are notorious for poor lifestyle choices, including lack of physical conditioning, all the while holding jobs that are physically strenuous, poor eating habits, and poor sleeping habits. EMS agencies should ensure that their personnel are physically fit and undergo a physical examination. Physical fitness should be considered an essential component of the overall training each agency implements. Lifestyle changes such as quitting smoking, lowering high blood pressure, reducing high blood cholesterol levels, and maintaining a healthy weight, managing diabetes can also reduce the risk of fatal heart attacks. Collisions account for a number of EMS line of duty deaths, LODD, each year. Excessive speed, given road conditions, and operator error are frequently cited causes of fatal collisions. Most importantly, everyone must be seat belted. Yes, this includes those in the patient care compartment. Only personnel who have completed a Virginia Office of EMS approved Emergency Vehicle Operator course, or EVOC, are allowed to operate EMS vehicles. You, as the EMS officer, are responsible for ensuring that the driver consistently follows the rules of the road. Certain exemptions are allowed for emergency response under the Virginia State Code. Remember that when you take advantage of them, you do it with due regard for safety. Motor vehicle accidents account for 20% of emergency responder deaths in the U.S. You can have an impact by insisting that your driver obeys the rules. As an EMS officer, it is your responsibility to ensure the integrity of the crew is kept throughout the operations. You must know the location and function of every provider. When more than one unit is responding to an incident, the officer should have access to a user-friendly accountability system. Accountability systems allow for officers to be able to easily identify personnel who are on scene, given a process to account for personnel quickly, and to ensure personnel do not go unaccounted for an extended period of time. Every EMS officer is expected to maintain continual connection between the functions being performed and the overall situation. This is one of the most important reasons for establishing and maintaining an effective incident command structure, ICS, at every incident. A risk benefits analysis is based on a hazard and situation assessment that weighs the risk involved in a particular course of action against the benefits to be gained using those risks. Risk a little to save a little, risk a lot to save a lot. The general knowledge requirements of an incident safety officer include safety and health hazards involved, infectious disease reporting, personnel accountability systems, incident scene rehabilitation. As you can see from this list, this person has to be a knowledgeable individual. The person is best filled by a senior member. Typical incident safety officer tasks include ensure hazard areas are established and communicated to members, as well as ensuring that they are adequately marked. As discussed previously, the safety officer must ensure an accountability system is used. When necessary, the safety officer will conduct an investigation after an injury, illness, or exposure has occurred. When a landing zone is required, the safety officer will evaluate hazards and communicate with the helicopter to ensure a safe landing zone has been established. The safety officer works to ensure compliance with the infectious control plan, and in some organizations, the safety officer may also serve as the designated infectious control officer. On incidents that have longer operational periods, the safety officer ensures that effective rehabilitation tents have been established. Rehabilitation is the process of providing rest, rehydration, nourishment, and medical evaluation to members who are involved in a strenuous or extended duration incident scene operations. Incident scene rehabilitation provides for medical evaluation, treatment, monitoring, and fluid and food replenishments, mental rest, and relief from climatic conditions. An EMS officer, you should emphasize the importance of rehabilitation to your personnel. Ensure they know to stop before they drop, cool down when they're hot, warm up when they're cold, and dry off when they're wet. Emphasize the importance of staying hydrated during their shift. Every injury or near miss should be viewed as a potential fatal or disabling situation, and injury prevention should be equally important concern of the EMS officer. Safety programs must address and prevent injuries before they occur. Most agencies have policies that regulate safety practices. The EMS officer needs to understand each of these, follow all procedures, ensure that all subordinates follow them as well. It may be useful to have providers review videos of incidents and then critique them based solely on safety policies. This will emphasize the way that things are supposed to be done and what actually occurs at an emergency incident.
As an EMS officer, you should encourage your personnel to sign a safety pledge, such as the one provided at the link above. The safety pledge encourages personnel to use safe driving habits, use seatbelts and appropriate PPE so that they arrive alive and stay.
Some agencies may require each individual to sign documents acknowledging and understanding of the safety practices. As an EMS officer, you should sit down with each new person and go through it in detail, each of these policies and procedures that are in place. After reviewing the policies and procedure, it is useful to have the personnel participate in a discussion about each policy. Some sources that can be used to seek examples of safety policies include Report of the Week from the National Firefighter Near Miss Program, the Secret List sent by Firefighter Close Calls website, information posted by the Emergency Responder Safety Institute, ERSI, incident videos collected by Statler 911, NIOSH case studies, the National Fallen Firefighter Foundation Near Miss Programs, Firefighter Close Calls, and ERSI provide training programs and teaching resources on their websites. EMS providers who are in good physical condition are less prone to injury as well as reduced risk of heart attacks. Strength and flexibility training allow the body to become more resistant to sprains and strains. Personal protective equipment only works if it's properly worn. Personnel should practice donning and doffing PPE. When involved with highway operations, all personnel should be wearing ANSI Type 3 reflective vest. All personnel involved in an extrication need to be wearing the appropriate PPE. Every EMS agency is required to have an infectious control program. The plan should have the following components: policy identifying and limiting exposures, risk management plans, annual training and education, designation infectious control officer, access to the appropriate immunizations, and a plan for handling exposure incidents. The most important first step with an exposure is to wash the exposed area immediately and thoroughly with soap and running water. The infectious control officer should be immediately notified after an exposure incident has occurred. The designated infectious control officer should arrange for the person with an exposure to receive medical guidance and treatment as soon as practical. Document all exposures as soon as possible using your department's standardized reporting forms. At a minimum, the record should include a detailed description of how the exposure occurred, what mode or route of transmission the exposure had, entry point, i.e., open skin, mucous membranes, airborne, etc. What personnel protective equipment was used at the time of the exposure, and all medical follow-up and treatment. The record of an exposure incident will become part of the personnel record. A complete record of the personnel exposure incidents must be available to the person upon request. Accident investigations. The health and safety officer is charged with ensuring that at all times, all injuries, illnesses, exposures, fatalities, or other potentially hazardous conditions and all accidents involving EMS vehicles, apparatus, equipment, or property. An accident investigation should determine the cause and circumstances surrounding the incident, as well as identify corrective actions needed to prevent a future accident. As an EMS officer, you may be responsible for conducting an initial investigation on a major accident and full investigations on minor incidents. An investigation consists of 3 phases: identification and collection of evidence, interviews with witnesses, written documentation. Each of these steps is essential for the development of a comprehensive report that can be used to initiate safer work practices and conditions. In a post-incident analysis, the incident safety officer provides a written report for the agency that includes pertinent information relating to safety and health issues involved with the incident. This would include information about the use of PPE, equipment, accountability systems, rehabilitation operations, and other issues directly affecting the safety and welfare of personnel at the incident scene. EMS agency building safety. PPE can become contaminated at an incident scene and should never be worn into the living quarters. Just as important is ensuring that the driver of the ambulance removes his PPE before leaving the patient care compartment and stepping into the driver's seat. Uniforms should be washed at the station. This ensures no cross-contamination between the family laundry and the work laundry. Clothing and PPE should be inspected regularly, ensuring that there are no holes or other damage that may reduce the integrity of the PPE or clothing. General housekeeping around the station is important in injury and accident prevention. When floors are wet, a wet sign should be used for warning personnel. All tripping hazards should be removed to allow for a clear walking path. Fire extinguishers should be maintained. Personnel should wash hands regularly and adhere to safe food preparation activities. In stations that do not have an exhaust system, officers should ensure that the vehicles are not left running. Back injuries can occur while lifting and moving patients or when carrying out miscellaneous tasks in the station. No matter what the cause, back injuries are serious and potentially career-ending. Proper lifting techniques should be used to reduce the risk of back injuries with an emphasis on bending at the knees and lifting with your legs and not your back. When additional help is needed, it should be asked for. In summary, the EMS officer is responsible for ensuring every provider completes every incident without serious injury and that everyone goes home. The EMS officer must develop an incident action plan that addresses and minimizes the chances of harm by identifying and controlling hazards. Vehicle collisions account for the second largest percentage of traumatic deaths in EMS.